Morning, and thank you so much for being here. I am State Senator LaTanya Johnson. I represent the 6th Senate District, and it is such an honor to have you here celebrating the second week of Black History Month with us. We are going to have a roundtable discussion with Wisconsin state agencies. In this 2021-23 state budget, Governor Evers and his administration and the other state agencies prioritized the health and mental health and overall well-being for families here in Wisconsin, and also for the students and communities. Today, we will hear directly from these state agencies and departments about how they prioritized investments to improve the health and well-being of African American Wisconsinites in their budget request, what they see as major challenges to addressing these disparities, and what they hope to accomplish within their agencies to improve the outcomes for the African American community today and also for the future.
Morning, and I would like to begin by thanking the Wisconsin Legislative Black Caucus, and a special thank you to Senator LaTanya Johnson, Representative Sheila Stubbs, and Representative Supreme Mora Omokunde for inviting Wisconsin Housing and Economic Development Authority, WHEDA, to participate in this roundtable as we celebrate Black History Month and beyond to discuss how we can address healthcare disparities and improve outcomes for all Wisconsinites, but in particular, Black, Indigenous, and people of color communities. I am proud to be joined today by agency leaders from DPI, DOC, and DHS, our partners in this opportunity to rise to the challenge to make a significant impact for those we serve in Wisconsin. We know it takes all of us, each and every one of us, to do our part. At WHEDA, cultivating an ecosystem, perhaps our version of It Takes a Village, which extends beyond what WHEDA alone can do and includes our partners, programs, and policy initiatives. It's like that pebble you toss into a pond that has a rippling effect. Its effect is felt beyond just its initial impact and reverberates outward to touch more lives. At WHEDA, we are cultivating an ecosystem of opportunity to increase diversity in homeownership and foster inclusion in affordable housing. We are working with our developers, lenders, and housing groups, community leaders, and elected officials to leverage our collective strengths and develop innovative solutions to help Wisconsin's changing housing landscape. We are listening to our stakeholders, strengthening our critical partnerships, and adapting our programs to drive systemic change and build a more equitable, sustainable place for all Wisconsinites to call home. So how do WHEDA's efforts around affordable housing and economic opportunity work to improve the health and well-being of BIPOC Wisconsinites, the topic we have been brought here today to discuss? What is the connection between housing, health, and racial equity? Well, I'd like to start with some simple math. And this equation is one I'm sure that will make sense to all of us. Healthy homes plus healthy neighborhoods equal healthy residents. Accessible, affordable, quality, stable, and safe housing makes a difference. At what point is the cost a family spends on housing considered an undue burden? Individuals spending more than 30% of their income on rent are considered rent burdened. The lower the income, the higher the burden. Living in unaffordable housing is associated with poorer health, self-rated health, hypertension, arthritis, and mental health issues. Draining these resources for rent means fewer resources are available for needed health services or prescriptions or food or childcare costs. Less energy efficient homes leads to higher utility costs. Energy insecurity related to worry over energy bills and adverse physical health outcomes, discomfort, stress, cold conditions are associated with depression, high blood pressure, and long-term respiratory conditions. Families doubling up and overcrowding leads to implications for more mental health issues, behavioral issues, and educational outcomes. The inability to pay a mortgage leads to higher risk for distress, anxiety, depression, substance abuse, and suicide. Housing instability often leads to forced displacement, eviction, and even foreclosure. What is the quality of housing? Older, deteriorating housing stock, outdated infrastructure, deferred maintenance also leads to adverse health consequences. Dampness and mold can leave long-term respiratory impacts. Lead exposure can lead to serious neurological problems and related cognitive and behavioral issues. Unsafe drinking water also has direct effects on health. Code violations may lead to accidents, often attributable to inadequate lighting, lack of window guards, lack of functioning smoke alarms. So what makes for a healthy neighborhood? Crime or living in fear of one's safety can contribute to mental health issues, stress, anxiety, depression, which can lead to reduced opportunities for physical activity and social disconnection. Living close to environmental hazards often leads to poor health outcomes. Accessibility of reliable and affordable public transportation makes it difficult or impossible to get to healthcare providers, places of employment, or to quality childcare facilities. Lack of access to green spaces, parks, and playgrounds impacts health and physical activity and mental health. Finally, living in food deserts limits access to fresh, affordable, and healthy food. And the research confirms that housing disparities have severe health implications that are disproportionately borne by marginalized populations. How did we arrive at this state of conditions? The inequities stem from historical practices such as redlining and COVID-19 pandemic. Here at WHEDA, we are extremely fortunate. Governor Evers appointed Joaquin El Toro as CEO of WHEDA. Joaquin pushed us at WHEDA to understand and to reflect on the housing industry's historic role in racist policies and practices. As an organization dedicated to helping communities achieve their affordable housing goals, it's been important for WHEDA to learn how complex social and political events have shaped housing policy. By learning from our history, we gain a better understanding of our path forward and create a true sense of urgency to address the systemic change necessary to help people and communities of color realize their hopes and dreams. Since 1972, WHEDA's financing has improved the quality of life for tens of thousands of Wisconsin residents. Yet, communities large and small across our state still lack capacity to offer their residents safe, affordable housing. We realize that to drive systemic change, WHEDA must leverage the collective strengths of its people, partners, and programs to create new approaches that drive community change. And this requires us to look differently at how WHEDA's tools and resources may impact communities of color. WHEDA has been on an exciting journey to seek new solutions and new ideas to improve access to equity in housing and economic opportunity. Here are a few examples of WHEDA strategies that are thoughtful and intentional to advance housing equity in communities of color, vulnerable populations, and tribal nations. Under Joaquin's leadership, WHEDA was able to develop initiatives to address racial disparities. First, WHEDA has a study on addressing barriers to African American and Latino homeownership in Wisconsin. Taking a racially informed and collaborative approach, we've worked closely with 150 stakeholders over the past several months, including African American and Latino homebuyers and homeowners, homeownership professionals, and our own staff. In the coming months, WHEDA will pilot several solutions and look to partners to implement others. We know that addressing disparities in homeownership takes the concerted efforts of players across the field working together toward a collective vision, and we at WHEDA are committed to doing our part. Second, we have launched a first of its kind WHEDA Supportive Housing Institute, first of its kind in Wisconsin. What is supportive housing? Supportive housing is a melding of affordable housing, bricks and mortar, roof, walls, combined with intensive coordinated services for our most vulnerable BIPOC populations so they can thrive. WHEDA is working in partnership with the Corporation for Supportive Housing, or CSH, a national leader in supportive housing, to connect our developers and community services providers with training, tools, and financing to expand the supply of this much needed housing in Wisconsin. WHEDA is also in the planning stage for a tribal supportive housing institute. Third, expanding equity and opportunity for emerging developers. Diverse developers hold a significant stake in building a greater equity in affordable housing projects throughout Wisconsin. Because of this, WHEDA increased housing tax credit scoring points within its 2021 qualified application plan for our longtime established developers projects, in which new emerging developers of color are able to hold a 24% ownership stake in the development. This decision resulted in 18 out of 33 awarded tax credit projects with minority developer collaboration. The experiences and insights of the emerging developers have brought innovative ideas and diverse voices to the affordable housing landscape. Through these partnerships, WHEDA is working to eliminate barriers and improve the odds for diverse entrepreneurs while securing a brighter housing future in Wisconsin. 4, engagement with Wisconsin tribal nations to understand their unique housing challenges. WHEDA respects the work of Wisconsin's tribal nations in expanding equitable access to affordable housing and economic opportunity. WHEDA values our partnership. WHEDA has a dedicated tribal liaison position at WHEDA to connect communities with Wisconsin's resources and will support the tribes in this work. Finally, WHEDA has a rural affordable workforce housing pilot. WHEDA is keenly aware that we have communities of color throughout the state of Wisconsin, rural as well as urban. And we embarked on addressing some of the shortage in affordable housing in rural Wisconsin, improving access to affordable shelter, and it's a fundamental to sustainability of our communities because Wisconsin provides a foundation for public health, economic well-being, and environmental stewardship. If Wisconsin is to thrive, this year is we are coming up on our 50th anniversary. We look forward to celebrating this milestone with our partners and continuing our collaborative work to drive systemic change and build a more equitable and sustainable place for all Wisconsinites to call home. Thank you.
I wanted to know, how is the state partnering with developers and local governments to create more affordable housing opportunities, especially in places that it is needed the most?
A core business practice of ours is administering both federal and state housing tax credits. And the demand for those tax credits exceeds the supply on an annual basis by at least sometimes 2/3. So we are not meeting, obviously, overall the needs of housing in Wisconsin. And we could be sitting on our laurels and say, that's fine. this is what we do every year, and whomever has stepped up to the plate and build up a long reputation and very deep pockets from doing business with us is enough. And, we would place housing units in the state. However, we feel it's important to use this core business practice as a way to incentivize changes in the marketplace. In terms of where we want to incentivize generally where the housing will be, and also who our partners are in providing to make that housing available. So one of the very best things I've been involved with WHEDA has been in regards to advancing opportunities for new emerging developers of color to get to do business with us and participate with us. This is an initiative that is not new entirely. I worked very closely with our previous executive director, Wayman Winston, to provide some learning opportunities for all, but we marketed very closely to the associates in commercial real estate graduates, the ACRE graduates out of Milwaukee, which are by definition developers of color. And they soak up every education we have, and they tried very hard to break into the industry over many years. However, when you get these credits, you then have to sell them to investors, and those investors are not always excited about doing business with somebody that does not have such deep pockets that they can cover the losses if there's any trouble, let me just say. So they tend to be inclined to work with long-time existing developers with WHEDA. So under Joaquin Altoro's leadership here at WHEDA, he went into our qualified application process. So the QAP is mandated by HUD and regulated by HUD on the federal level. And every 2 years, there's a comprehensive look. Is this really incentivizing the market changes that we want? Are we being responsive? Should we have points for being on a bus route? Should we have points for being in a residential neighborhood? Should we have points for rehab? Should we have it for new construction? And all of those things. And we've had in the past points for working with emerging developers. However, Joaquin adjusted it to have those points also require a 24% equity ownership by emerging developers. And those points were very valuable because I did cite that we saw, I think it was 18 out of 33 awardees partnering with new emerging developers. That's double the results we've seen in the past, something we are very, very proud of and excited about. These sort of equity partnerships really are the glue for developers who've been in the business for a long time to spend their time, and time is money, to mentor and bring along new developers. And so we are seeing that happen in a big way this time. Very exciting. Our emerging developers have also frequently experienced housing insecurity in their lives growing up. And those experiences have shaped their career choices and their personal mission to partner with WHEDA to expand equity in affordable housing and economic development. And even a further exciting outcome has been, we see developments that have been awarded credits in rural parts of Wisconsin where there are a lack of developers available. And there are partnerships with our emerging developers from, say, Milwaukee, working in, say, Sheboygan or parts of Wisconsin, more rural. And that's just really exciting because that's also going to meet a need for more developers to be available where those housing concerns and needs are. So does that answer the question?
It does. And I noticed that you said in your presentation, I think you said 18 out of 23 projects were with
33 out of 33.
18 out of 33 projects.
Mm-hmm.
They were developed with emerging minority developers. Is that?
So the applications came in in partnership with emerging developers. And those are from the 2021 QAP cycle. So those folks are now in the process of obtaining many other funding sources to line up along with this. And as you know, we're a little worried the market has gotten a little more tumultuous lately, but we are watching matters very closely here. And then those would go into service most likely like next year. It's pretty much a 2-ish year process minimum from beginning to end to the building being built.